Okay, so we're back at a point where we're going to remove the bonding now, and it's this way. By doing that, we're have the holes open on the valve. Thank you. Well, by doing that, this all should come right out. This is a good 2, 3, 4 millimeters unscrewed. So uh, just going in and just getting rid of the composite that I just placed. As a routine, you just create your scaffold, go in, get the screw loose, and now you just want to go in and and there's a lot of composite here, so comes off pretty easy. And then we'll clean it all up. Once we do that, you'll see how that comes out. And if I got to rebond it back in there, I'll rebond it back in there. That's the beauty of this material. Just take some regular composite, direct composite, etch the porcelain. Okay. And we're going to add a contact too, so. Just let it come apart on its own. Don't force it. Okay, so there's some bonded resin still holding it. There it is. Now it's loose. Now gently, just gently. Okay. So you see now you got easy access to the screw. So I do have to hold with one hand because the screw still wants to come out. And we'll take a pair of cotton pliers and have that ready. And now I'm going to just gently take the rest of the screw out. Hopefully it's just the screw and not the whole fixture coming with it. She didn't report of any pain. That's the biggest thing we don't know, the condition of the fixture underneath. We'll see. So we got our screw coming. Okay. There's always something holding the screw. Every screw is a little different. There we go. Okay, folks, this is coming out. See how now that access hole, you can just bring it in any direction, but the thing is now the whole thing is crown, abutment, and screw are loose, so you've got to kind of keep one. I'm going to hold this, maybe do this left-handed. I'll hold with my right hand and retract a little bit of her lip. And now the beauty of this is it's all direct. So there it comes. Good to the last thread. We'll have a tartar and stain pouch ready to go. We'll be putting this all in that. Examining the screw itself. We were told to get a RP Brandemark screw. We were told to do that. Okay. And it'll let go. Guess I could have slotted it, but go. There's probably tartar in there. Let's try to find a square instrument. Maybe one of my handmade instruments can get in there and just get a square instrument. While we're getting that, I'll just use this Explorer, continue to try to turn it. Pretty soon I'm going to have to look at hygiene. Hopefully, if we can pass on hygiene right now, I want to finish. See, it's a lot harder to turn this screw, but yeah, it's well on its way. We just gently. I can turn the crown, but I don't want to turn the screw with the crown. You might as well bond the screw and let's see. Maybe that square end one that's like a hatchet or a hoe. It's got a square end to it. Something like that. Yeah, that's the grab. There we go. Okay. How about that? Okay. Suction ready case. High speed suction ready. There it is. Suction, please. All right, we got it. Now, we're going to put this in a cleaner just to look at the bottom. The screw's there, and it's not a fractured screw, guys, okay? It's just a worn out screw. There's your hex. That goes in tartar and stain for at least 10 minutes. I'm going to change my gloves real quick. We're going to look at this this abutment and the threads, and we're going to start our whole mission of cleaning the threads and get them meticulously clean. No, we're going to use a new screw. Yep, I ordered it. So before we had an X-ray to go off of, and so we knew what size to get and what type. So that's the good news, is you got a brand new one. Okay, so first thing I'm going to use is chlorhexidine gluconate. There's our implant. So you're going to see a lot of like stuff inside and out. You'll see particles, bioburden, you name it, it's in there. We got to get it out. Don't want to put a screw in there. You just complicate things without it being clean. The next thing I have to do is I have to treat it with TNS, tartar and stain. And again, we put a drop down in there and it's got to do its job to dissolve. Now, I'm going to ask my patient if she's doing okay. You doing good? All right, that's a big thumbs up on her end. And I got to go check hygiene. So I'm going to pre-soak with TNS. Just let it do its thing. The syringe is gone? Oh, okay. Got it. Okay. Give her a new cotton roll. For our viewers who just tuned in, I'm just right now, I'm walking through the steps. We're successful in removing the screw without any trauma, and I don't want to poke you. Yep. Okay. Now we got to look down into the screw head. Now there's all kinds of dark stuff down in there and stuff that leaked through. So first things first, let's put 1 to 2 drops of tartar and stain. We just gently go right in place. Okay. Small suction ready. Oh, rinsing. Okay. You okay? Any bad taste at all? We're good? Any bad taste at all? None? Okay. Cotton roll. All right. Okay. Suction with me. Suction on. I just want to put a drop in there. Oh, we can dip it. Yeah, we can do that. Yep. Is that the same stuff? All right. All right. Let's drop. We're going to drop some in a little different method here. Oh, suction that. There's a lot of stuff coming up. Look at all that. Let me zoom in on that. You see what's coming up? So that's what happens when metal and metal rub together too. You're going to get a combination of things going on. So I'm going to rinse that again. And then we have to look at the threads and see if there's any damage to some of these threads. So let's see. I'm going to see if I can put a drop in there. All right. And I want to suction out what might be in there with a micro suction tip. Okay. So micro suction tip, 20 gauge or 25 gauge. I forgot what this is. There's the hex. It looks like it's in perfect shape. So that's good news. So we'll examine the crown, the abutment, because she needs to know that too, if that's in perfect shape. As it's it's a good day for her. She doesn't have to go through surgery. But the options are, if she wanted to have something new made, she could. But we're going to check everything. That's why we're recording. That's why we're looking at it. You're seeing it. I'm seeing it. She can see it if she wants to see it. I'm going to put a drop in there. So TNS. Let's see if I can just put a drop, single drop here. It's so hard to do this. I just want one drop. I don't want a whole mountain full in there. Let me see if I can get one out on the end of it. There we go. Oh, got it on the mirror. Rinse her. Okay. Okay, so we got some in there, and we're going to let it do its thing. Put it on the outside as well, a little bit. You okay? So if you feel like you've got any bad taste, let us know. We'll rinse you right away, all right? So she's going to turn, don't try not to close now. Going to turn to your left, because Jen's going to be kind of watching things with you. I'm going to go check my hygiene. I'll be back. We'll finish things up.